Well, thank you very much, Senator Tester and Ranking Member Moran, for holding this hearing on what is a critical issue of vaccine distribution to veterans. And I just want to say I'm really excited to be a member of this committee and really looking forward to the work that we can do together to serve our veterans. And I want to thank the witnesses today for your work to serve our nation's veterans too. Dr. Kim, I wanted to start with a question for you. First, thanks for working to get these vaccines out to veterans as quickly as possible. New Hampshire, as you probably know, doesn't have a full-service VA hospital, and as a result, Granite State veterans get some of their care across the border at the VA Medical Center in White River Junction, Vermont, or in Bedford, Massachusetts. That can create some challenges when the states are not fully aligned in terms of vaccine availability and protocols. So how does the VA determine the vaccine allocation for these kinds of facilities that serve veterans across state lines? And what steps are the VA taking to disseminate the information to veterans who may be crossing state lines to get their care?
Sure. So I think, Senator, that the answer to that question is that we know for the veterans who receive care in a certain medical center who they are. We know their age, their demographics, et cetera. So whether they live in New Hampshire, or whether they live in Massachusetts, if they're served by that medical center or clinic, we know whether they're in a priority phase for vaccination. So we will reach out to them regardless of where they live. I have patients who I see in North Carolina, but they live in Virginia. Right. But to me, that doesn't matter. They are served by me, so I'll reach out to them when it's their turn. And I think the same would apply to your veterans as well in your state. Maybe I wonder if, the question is whether, I know each state has their own phase where they are. Certainly, each state has flexibility to do that. For the VA, we do follow CDC, but there is flexibility, say, for your area of the country for that particular VA to move into phase A, 1A, B, or C, depending on how much supply they have. But it really depends on the veterans they serve in that facility as to, when they're reaching out to them.
Thank you. Another question for you, Dr. Kim. Many facilities are offering an online appointment registration system for veterans to sign up for the vaccine. And if this has been asked already, forgive me, but the online portals are obviously a great tool. Some veterans may struggle with the technology, though, or they don't have the connectivity to access the system. And many veterans in my state live in rural areas, which one has less access to broadband. Also, a lot of veterans in my state are older and have less exposure to online tools. So what alternatives is the VA offering veterans who may have limited internet access or technological know-how to register for appointments online?
Sure. I will just say, and I will let Mr. Gelati and Dr. Patterson comment, we are using all modalities that, especially those we know that our veterans in each medical center respond to. So I'll let them.
Thank you.
Senator, in that scenario, the partnership with American Legion, Disabled American Veterans, and other service organizations is critical to get the word out. One thing we've also had great success with are electronic town halls. They've really ramped up in the last year due to pandemics. The minimum attendance that we've had is 1,500, and in some cases up to 8,000. So veterans getting the word to other veterans has also really helped in that scenario.
Yes, Senator, the veteran service organizations are a great partner in this way. We reach out to them, ask them to contact their members, and they'll also contact other people in the community, even if they aren't a member of the VFW or the Legion. And we're using some of their facilities because it's a great drawing point.
That's great. Yep. Thank you. I will just echo what Senator Sinema was just speaking about in terms of making sure we're getting to our rural veterans in remote areas. And it was great to hear the pilot programs you have up in Pittsburgh, New Hampshire, which is on the Canadian border. It's one of our largest towns, but it has 900 people total. And it's a beautiful spot, but it takes 3 hours for people in wintry weather to get to Manchester. So I really appreciate those efforts and would like to work with you all on expanding them. Dr. Stone, I wanted to drill down a little bit on the data you have about veterans who are declining the vaccine. We've begun to see data on the rates of certain segments of the population declining to get the vaccine, including actively serving military members and first responders, something that you've heard about from other members of the committee too. In your testimony, you described listening sessions with minority veterans and other concrete steps that you're taking to help reduce vaccine hesitancy among the veteran population. Now that vaccines are being administered, are you gathering data on how many veterans have declined to receive the vaccine and whether their reasons match the concerns you were hearing about during your planning?
Yeah, I don't think our data is as clear as it should be.
Okay.
And it appears that about 15% of the population is declining. And then as time goes on, much of that is just a hesitancy.
Yeah.
That once their friend begins to get it, or a fellow veteran or a family member does, they will then go ahead and get the vaccine. So the numbers are declining of hesitancy,
Yeah.
but it requires a very active listening sessions and engagement of that population in order to resolve it. I will tell you, I've worked the vaccine clinic that we've been operating in Washington, D.C. Many of the people coming in, especially in the communities of color, want pictures taken so they can send it to their family members saying, look, I got the vaccine. It's been a very emotional engagement.
Yeah.
Even as a provider with 40 years of experience, these are very emotional engagements for many of these families. But it is those kind of things that we've been talking about that I think has made us successful in erasing a lot of the hesitancy. Now, there is a portion of the population that will never get the vaccine, and we've seen that with vaccine really refusal across many areas of the country over multiple types of vaccines. This is a really unique new types of vaccines that we're dealing with. And it's just going to take a lot of education and a lot of work and a lot of trust for us to get to where you and I would like to be on this.
Thank you very much. Thank you, Mr. Chair, for your indulgence.
Thank you, Senator